Hello, my name is Stacy Kuzler and I am with the Center for Rural Health, and I am going to be talking about various loan repayment programs available in the state to nursing professions. Loan repayment programs are a joint effort between the North Dakota Primary Care Office, housed within the North Dakota Department of Health, and the North Dakota Center for Rural Health. Together, our offices promote and or directly manage the loan repayment programs I'll talk about today. The loan repayment programs available to nurses that I will discuss today are the North Dakota Healthcare Professionals Loan Repayment Program, or STATE, the Federal State Loan Repayment Program, also known as SLURP, the National Health Service Corps, and Nurse Corps. So I will briefly describe each program on this slide and then go into detail on each one in the coming slides. So first is the North Dakota Healthcare Professionals Loan Repayment Program, or STATE. Awards up to $22,000 over a 5-year agreement for the professions of advanced practice registered nurses and behavioral health registered nurses. $20,000 of the total award is provided by state funds, and the remaining $2,000 of the total award is provided in the form of a community match. Community match funds can come directly from the employer, from a business in town where you'll be working, a foundation, or other organizations. The match cannot come from you yourself, from a family member, or from any individual not associated with an organization. The Federal State Loan Repayment Program, or SLURP, provides a total possible award of $50,000 per year for 2 years. APRN, certified nurse midwives, psychiatric nurse specialists, and RNs are eligible for this program. Eligible practice locations must be located in a health professional shortage area, or HPSA. They also must accept Medicare and Medicaid, offer a sliding fee scale, and be public or nonprofit private status. The community match portion for this program is 50-50, meaning half of the total possible award must be provided through a community match. In the next few slides, I will explain further what a HPSA is. The National Health Service Corps, or NHSC, is a federal program awarding health professions up to $50,000 over a 2-year agreement. There's no community match requirement for this program. However, applicants must work at a health professional shortage area, and the facility where applicants work must be an approved National Health Service Corps site. Priority is given to higher HPSAs. And finally, the Nurse Corps program is another federal program awarded to RN, APRN, and nurse faculty. This program will pay up to 60% of your outstanding student loan debt in exchange for working 2 years in a critical shortage facility, or CSF. A CSF is a public or private facility located in a HPSA. This could be a hospital, FQHC, Indian Health Service, critical access hospital, nursing home, and more. So you've heard me mention the term health professional shortage area, or HPSA. HPSA scores are important when discussing loan repayment programs. It's a score determined by a number of factors to indicate the level of need in a community, county, or population. There are 3 kinds of HPSA scores. There's primary care, dental health, and mental health. The higher the score, the higher the need. Counties within a state can have a score that covers the entire county, or it can be based on partial county or even a facility. If you're curious about a specific score based on where you're working or hope to work, you can easily go to data.hrsa.gov and search for HPSA scores by state and county. Here's a map of North Dakota's primary care HPSAs. This map, as well as other HPSA maps, are located on the Center for Rural Health's website, which is ruralhealth.und.edu. Then navigate to publications and maps. So the map on your screen shows two images. The top image indicates facilities that have their own HPSA score. This is possible based on the population they serve. They also indicate federally qualified health centers, rural health clinics, and state-funded institutions like correctional facilities. The bottom image indicates the counties in the state that have a designation. This means any qualifying health facility within that county will adopt the county HPSA score. As a comparison, this is a map of the mental health HPSA scores in the state. Again, you can find this map on ruralhealth.und.edu. Now to describe each program in a little bit more detail, starting with the North Dakota Healthcare Professionals Loan Repayment Program, or STATE. Eligible nursing-related disciplines for this program include APRNs, behavioral health RNs, and specialty practice RNs. The STATE program is one of the more lenient programs as far as applicant eligibility goes. Unlike the rest of the programs I'll discuss today, this program does not require a HPSA score to apply. However, this is a competitive program, meaning there are often more applicants than there are funds to award. Prioritization by the applicant review teams often factor in HPSA scores, meaning if we have two applications, one for a HPSA area and one that is not, oftentimes the HPSA will be prioritized over the non-HPSA. When applying for this program, also please pay close attention to your essay and description of why you want to serve in your community. That portion of the application is reviewed very closely. So under the STATE program, nursing professions can receive a maximum award of $22,000 over 5 years, or $4,400 per year for 5 years. A community match must be achieved prior to applying, so it's important to discuss this with your employer before you apply. Payments are made in equal amounts at the end of each year of service. So once you complete your 12 months, you'll receive $4,400. And then the next time you complete 12 months, you'll receive the next $4,400. If you decide to leave your employment before your 5-year loan repayment agreement is up, you forfeit any remaining loan repayment amounts. I'd also like to note here that any education loans you have should stay separate from any other loans you have. In other words, don't consolidate education loans with a home loan or a car loan, for example. This makes it impossible for programs to know if they're helping you pay off education debt, and therefore you would not be eligible for loan repayment. Applications for this program open each year in November, and applications are accepted through March 15th of each year. Applications are reviewed and awards are announced in May, and loan repayment contracts start in July. So now let's talk about the Federal State Loan Repayment Program, or SLRP. So SLRP stands for State Loan Repayment Program, which is the name of the federal grant the primary care office uses to administer this program. This is not to be confused with the North Dakota Healthcare Professionals Loan Repayment Program that we refer to as the state program. SLRP awards up to $50,000 per year for 2 years, equaling a max award of $100,000. Half of this amount needs to come from a community match, which again can be sourced through the employer, through a partnering community business, a job development authority, or any other creative way to achieve a match. Match funds cannot come from a family member or from an individual not tied to an organization. Eligible nursing disciplines include nurse practitioners and registered nurses. And applicants must be U.S. citizens in order to apply for this program and have an approved North Dakota license. Telehealth providers are not eligible to apply unless they're located in North Dakota and providing a majority of direct patient care. The facility where you work must be a public or private nonprofit status. And eligible sites must accept Medicare and Medicaid, have a HPSA score, and offer a sliding fee scale to patients. Match funds must be secured prior to applying for this program. Applications for SLRP are accepted year-round and awards are paid 90 days after the start of your loan repayment contract. There are significant penalties for leaving this program before your 2-year agreement is over in the amount of $7,500 per month that was not served, plus interest. As with all loan repayment or scholarship applications, be sure you're choosing a location not just for loan repayment, but for good community and facility fit. This will help ensure you're happy and not needing to leave prior to the completion of your contract. Next, let's discuss National Health Service Corps. So NHSC is a federal program that has received a lot of attention within the past 2 years as more and more funding is going into this program to combat opioid and substance use disorders, as well as residual COVID-19 response. Eligible nursing professions for NHSC include nurse practitioners, certified nurse midwives, and psychiatric nurse specialists. For NHSC, the site where you're working or hope to achieve loan repayment through must be an approved National Health Service Corps site. Eligible sites are easy to find by going to connector.hrsa.gov and searching for your area of interest. In North Dakota, there are nearly 80 approved NHSC sites. Key eligibility criteria for sites and providers include having a HPSA score, providing service regardless of patient's ability to pay, and accepting public assistance patients such as Medicare, Medicaid, and CHIP. NHSC has a number of programs to choose from. Nurse practitioners, certified nurse midwives, and psychiatric nurse specialists are eligible for all 3 programs you see on the screen. RNs are eligible for the SUD and Rural Community Loan Repayment Program, and CRNAs are eligible for the Rural Community Loan Repayment Program. As you can see, each program offers a different service requirement and award. NHSC offers $50,000 over 2 years. The SUD program offers $75,000 over 3 years, and the Rural Community Program offers $100,000 over 2 years. And if you needed a sign to provide SUD service and treatment going forward in your practice, here it is. Applications for NHSC typically start in the spring around May. You can go online and sign up for email notifications so you're alerted when applications open. Finally, we'll talk about Nurse Corps. Nurse Corps is also a federal program offered to registered nurses, APRNs, and nurse faculty. Unlike the other programs that offer a dollar amount per year of service, this program pays based on your outstanding education loans. The program will pay up to 60% of your outstanding student loans for a 2-year service commitment. You can also be eligible to apply for a 3rd year at an additional 25% of your student loans. Priority is given to applicants with higher amounts of debt, and nurses applying for this program must work at a critical shortage facility, which is defined as a facility located in a HPSA. This is a copy of the Nurse Corps fact sheet that lists eligible facility types and funding preference. Application for Nurse Corps, the Nurse Corps program typically opens around February of each year. And you can also sign up for email notifications so you're alerted when applications open. One final nurse incentive program that's worth mentioning is the non-resident nurse employment recruitment program, which is available through the North Dakota Department of Commerce. This is an incentive more for employers to be hiring new nurses or nurses from out of state. Under this program, employers can be reimbursed up to $1,000 per year for 4 years to hire either new nurses who have not been employed within the past year or nurses from out of state. The program was originally formed to bring back nurses that may have left the state after graduation and it was recently amended to include new nurses who have not been employed in the previous year. While this is not a direct incentive for nurses, it's worth mentioning in case your employer would like to look into this program. Some facilities do use this to strengthen their existing recruitment incentive programs, so it could come back to you, the nurse, through a sign-on bonus, for example. So as we wrap up, here's the summary of the programs we discussed, along with links to the application pages. Please note that each program has a different application timeframe and award amount. I also want to note that while you can apply for more than one program at a time, you can only accept one award at a time. For example, if you apply for both SLURP and NHSC at the same time and find out you were accepted to both, you can accept one but decline the other. This is the case for all loan repayment programs. Simultaneous awards or double dipping is not allowed. If you're looking for jobs in rural or underserved areas of the state, please take some time to visit 3rnet.org. It stands for the Rural Recruitment and Retention Network, and it's specifically designed to connect healthcare workforce to rural and underserved communities throughout the country. North Dakota has many nursing related jobs posted right now, so I encourage you to take a look. If I can be of any assistance to you in your job search or to further explain any of the programs that I talked about today, I would love to hear from you. My contact information is on your screen. My colleague, Kaylee Werner, is with the primary care office and can also answer your questions. Thank you for choosing to enter into a nursing career. North Dakota needs you, and we look forward to seeing you in the workplace soon.